pain in men gets missed a lot, especially when it shows up in ways that are not considered pelvic at all. In this video, I'm going to explore different presentations of pelvic floor dysfunction with the focus on pudendal neuralgia. Pudendal neuralgia is irritation of pudendal nerve, and if you look it up, it scares the heck out of you because it is difficult to treat when so many things get done to it. Meanwhile, what I wish was happening was at the site of the initial presentation of symptoms that resemble pudendal neuralgia, we would focus on pelvic stability instead. So pudendal nerve come from the back of your pelvis, and they go through this tortuous path. Inside, they go through these little holes, through these muscles and tight spaces, and they exit. And in men, there are three branches. In men, they can go to the penis, to the perineum, and to the anus. Perineum is the space between the back of the penis and the anus. This is where the sensation is. There is that burning, numbness sensation. There is that pressure in the perineum, in the penis, and the testicles. Most often, I see it happening on the left side, and the reason for that, from the research I've done, has to do with the fact that the nerve on the left side it bifurcates, it branches off, whereas on the right side it's not. Now, why would you have pudendal nerve irritation is the question we want to answer first. The muscles inside of your pelvis work with the outside of your pelvis to stabilize the pelvis. The reason for this double reinforcement, one of the reasons, has to do with the importance of keeping your pelvis stable, because your pelvis is a foundation to the structure above. With an unstable foundation, the structure above is compromised. So when the outside environment is not providing stability, the inside have to make up for it. The inside has a set space, and there are certain things that reside here. There is intestine in the back, there is your bladder in the front, there is your prostate in the middle, there are tubes that allow the prostate and the bladder to exit through the penis. Then you've got your arteries, veins, nerves. You have muscles, ligaments, and joints. So when the muscles on the inside tense up, the wall gets thicker, the space becomes smaller, and you can have different presentations depending on what structures are being compressed. When the pelvis is unstable, and let's say you have a posterior pelvis where your pelvis is tilted with your tailbone under you, you can have the thick wall with a focus on the posterior back structures. Or if it's anterior pelvis, it would be the front structures. Here's the catch. It never stays at anterior or just the posterior. So you can oscillate back and forth with more in one direction than the other. So you can have different presentations. So when it comes to pudendal neuralgia, what we want to do is, and the symptoms that come with that, what we want to do is we want to stabilize the pelvis, and we want to stabilize your whole body. So how do we stabilize the pelvis? Well, I use biological breathing because that's the number one requirement for you to even have a chance to stabilize your body. Biological breathing, if you don't know how that's done, make sure you subscribe to the channel. I'll make sure I put it at the end of this video. But biological breathing is how we naturally relax the muscles on the inside of your pelvis, and in the process of breathing out, those same muscles come together like a soft set of hands pressing on a bag of, let's say, water to then flow the water up. So every breath conditions the inside to relax and for the same muscles to work together. So at a frequency of every breath, Your body is trying to give the pelvis what it takes to be stabilized. So your lifestyle, your habits, all of these play a role. So you need to understand what you need to do to support the area. Now, how do we go ahead and fix it? I use developmental exercises as the focus of my practice. Developmental exercises are what you and I did as babies to then stabilize, coordinate our movement pattern to become so stable and so strong that we can now start walking and running like a running toddler. We start losing that connection as we start resuming lifestyles that are in conflict with the design of the body. That's like going to school and sitting for an extended length of time, playing one-sided sports, injuring ourselves, etc., etc. We're not going to make this video about that. Back to pudendal neuralgia, I use developmental exercises as the method to now stabilize the pelvis and what's connected to the pelvis. This is how our brain was hardwired to perform. Our body parts recognize as an authentic, great environment to support the right move. So we need to give the body the environment it recognizes to thrive in. So that means you, as the owner of your body, need to understand what right looks like, what your tendencies are, how to replace yours with the right, how to resume and preserve the right in all of your movement patterns, and when you deviate from that, how to grab yourself and put yourself on the right track. Yes, that means you need to be responsible for how to live your life. That should not be a surprise to you, I certainly hope. I hope this made sense. If you have any questions or comments, make sure you use the opportunity below to type it, and I will respond to it. If you have not subscribed to the channel, make sure you do. And if you need help with your pelvic floor dysfunction and your pudendal nerve irritation, contact me. Thanks for watching.